All right, let's talk more about all this now with Chris Meekins. He's the healthcare policy analyst at Raymond James. Chris, good to see you. Good morning. I'm going to ask you the same question I put to Anjali. How dangerous is it for public health now that the U.S. has withdrawn from the World Health Organization?
I think from a global perspective, what we learned from this virus is that what happens in other parts of the country can dramatically impact the United States and the U.S. economy. So you really need to be proactive in helping other nations manage these crises, manage their public health concerns, so you don't have it at home here. That was the purpose behind the World Health Organization, and really why the U.S. had funded the organization at such a degree. This is not just a matter of the U.S. saying we're not going to play with these other countries and collaborate. There's still maybe one-off collaborations that occur. This is really a funding issue from the World Health Organization because the U.S. contributes such a large portion of the World Health Organization's budget that if that money goes away and the additional money the U.S. would normally donate when there is a public health emergency of international concern, like Ebola in Africa, the result of this could be that we see viruses spread significantly more than they would otherwise have done.
Chris, it's been a pretty, I would say, a fascinating few weeks on the COVID-19 treatment front. I won't say vaccine, certainly a treatment. Of course, yesterday with the Novavax news, do you think we're heading towards a vaccine quicker than maybe market participants and the general public think?
I think we're moving very quickly, but the market, largely speaking, in my opinion, has priced in the fact that we probably will get a vaccine approved by the end of the year, maybe even before the election. We anticipate a lot of pressure from the White House on the Food and Drug Administration to do that. And what I think one warning sign is vaccine development is hard. There's a reason it usually takes years to do it. And the market has seen up to this point everything go really, really, really well, better than we could have expected, honestly. And so we probably will have a setback with one or two vaccines, but that's part of the reason the government has invested so widely in multiple different companies with multiple different mechanisms of action in hopes that at least one of them will work.
Chris, President Trump making a major push to reopen schools in the fall. He says it's important for our country. He says that local leaders are keeping schools closed for what he calls political reasons. From a policy standpoint, what do you make of that?
I believe, generally speaking, if we take the appropriate mitigation measures, we should do everything possible to try to get kids back to school for a wide range of issues. We know a large portion of kids in the United States rely on schools for their meals. We know a large portion rely on schools for education, and we have a decent number, and way more than we would have liked, number of kids exposed to child abuse at home. And we see the increased stressors of the virus negatively impacting kids. So if there's an opportunity to get them in a structured, safe environment where we can have meals and other activities for kids and continue to advance their education so that we don't see the disparity between lower income kids not being able to get online, not being able to keep up to speed in classes, and the more wealthy kids that have parents that are potentially more engaged or at least financially in a better position to make sure this stuff gets done. I think that gap is only going to continue the longer kids are not in school. So do I think it's politically motivated? No, I think it's motivated over a real fear about the virus continuing to spread. But I think if there's a way to safely do it, we should try to get kids back in school because that's in the best interest of the kid.
Jared Blicker here, just kind of building on that. There's been a lot of talk about sports reopening, but what about, and that's on the professional front, what about recreational sports and activities? Because I know I've been a lot more sedentary over the last few months, but especially the kids that you're talking about, what about getting them active again? What can we do to help them?
Yeah, I think in different parts of the country, we've seen different activities. One of my colleagues has multiple sons that all play traveling baseball in Florida, and they went back a month ago, and they've been all over the state to tournaments and other things. So I think in different parts of the country, we've seen reopenings, and it's good to get kids out and doing things, and being outside is better, is safer, we know, than being indoors in the AC. So I think you have to look at the recreational activities on a case-by-case basis. And what's in the best interest of the kids, as well as what you can do from a safety perspective.
Chris, some notes circulating on Wall Street trading desk today that a Joe Biden presidency wouldn't be good for healthcare stocks. Explain that to us, because I think a lot of people don't think that wouldn't be what they would originally think of.
And yeah, I think there's two different ways to think about this. Joe Biden presidency with the Republican Senate probably would have a bit of a mixed bag. He would take steps to try to expand coverage. It'd be good for some of the managed care names, some of the Medicaid exposed names in that area. I think on the pharma side, he'd try to do regulatory action to control pharmaceutical prices. I think if you have one party control, that's where things really get problematic. We went back and looked at the end of last year, actually, from 1980 to present. And what we know is when one party controls all of government, healthcare tends to underperform the S&P. And when Democrats have complete control, only one of the 4 years when that's happened has healthcare outperformed the S&P. And on a relative return basis, it tends to underperform by at least 6%. So what we see is when there's potential for big disruptions, which happens when one party controls everything, healthcare stocks tend to get nervous because they don't know what the outcome of that will be. I think that if you see divided government, healthcare should be in a good position.